All right, this is the California Nursing Home Administrator Exam Questions Review presented by Next Generation Training. If you are or know someone in need of additional training or practice test questions for the Nursing Home Administrator Exam state examination in the state of California, please feel free to visit www.lamontgjones.com, where you will find additional practice test questions in the state of California for your study material. You can also find additional study questions on Barnes and Noble, where you will also find a practice test question there for you as well. So let's get started. This is just a sample of some questions that are similar to those on the California Nursing Home Administrator exam, and I hope that they will help you in preparing for your examination. So let's get started. All right, so here is our first sample question, and this refers to a method other than orthopedic braces used to assist patients to achieve proper body position and balance that may only include soft ties, seat belts, spring release trays, or cloth vests, and shall only be used to improve a patient's mobility and independent functioning, to prevent the patient from falling out of bed or chair, or for positioning rather than to restrict movement. So let's look at our choices. We have A through D. So A is movement support, B is standing support, C is postural support, and D is restraint support. So what do you think the answer is going to be? Let's check it out. All right, so the answer to this question is C, postural support. And you're going to find this answer, and you can read it for yourself, but it's under section 72319 under nursing services, restraint, and postural supports. Okay. All right, let's go on to. All right, so the answer to this question is D, 40 hours. And you can find that in section 72465 under special treatment program service unit. It's under where it says staff. And so it basically says a registered nurse, licensed vocational nurse, or licensed psychiatric technician shall be employed at least 40 hours a week on the day shift and be responsible for nursing supervision of the distinct part. If the facility has a total license capacity of 59 beds or less, the director of nursing services may also be the charge nurse for the distinct part. So keep that in mind, because that could also be another question that you could find on your examination as well. All right, so let's move on to our third question. Nurse Dorothy filed for an application to continue education. If the department received her application on December 1st, when will she possibly be informed whether the application is complete and accepted for filing, or that the application is deficient, and what specific information is needed? All right, so the answer to this question is A, December 28th, and that's found in section 71 845. I'm sorry, continuing education. And B1, starting from the date the department receives an application for a continuing education program, the applicant shall be informed within 30 days whether the application is complete and accepted for filing, or that the application is deficient, and what specific information is needed. Among the choices provided, only the second option, December 28th, belongs within the 30-day period. So that is why we're selecting December 28th. All right, moving right along. So, facilities shall employ a registered nurse or licensed vocational nurse blank hours per day on the day shift, blank days per week. So, we have 12 hours per day on the day shift and 5 days per week, 12 hours per day on the day shift, 7 days a week, 8 hours per day on the day shift, 5 days per week, and 8 hours per day on the day shift, 7 days per week. What do you guys think the answer is? All right, so if you guessed answer D, 8 hours per day on the day shift, 7 days per week, you were correct. And that's found in section 73319, nursing services staff. Under subsection B, facilities shall employ a registered nurse or licensed vocational nurse 8 hours per day on the day shift, 7 days per week. In case of facilities where a licensed vocational nurse serves as a supervisor of health services, consultation shall be provided by a registered nurse through a formal contract at regular intervals, but not less than 4 hours weekly. All right. Well, thank you for taking the time to watch this video on some sample questions for the nursing home administrator examination in the state of California. For additional practice tests, feel free to visit my website, lamontejones.com, which is Next Generation Training. I also have a practice test available on Barnes & Noble where you can order it and get a hard copy of a practice test that has 100 questions on it as well, and it will help you to pass your examination in the state of Tennessee. Thank you so much, and good luck on passing your administrator's exam in the state of California.